Okay, so this is a reporter Davis Kim from AV News. So again, we are doing the pre-event meetup with companies in Incheon Pavilion at CES 2024. I'm with Hubert from Ubergizmo and a representative from RisingCraft. Nice to meet you.
Hello,
So,
how are you? I'm Hubert. I'm based in San Francisco. Nice to meet you.
yeah. So could you exchange some greetings while we test the audio, please?
Hi, I'm Daniel Kim from the marketing team of RisingCraft. Can everybody hear me clearly?
Yes.
Nice to meet you, Daniel. Your sound is great.
Oh, thanks. Great.
So how long have you been working in this company?
Oh, couple. Me?
Mm-hmm.
Oh, couple of years.
Oh, okay, nice.
I've known them for a long time. Yeah.
Oh, I see. Are you based in? Is the company based in Incheon as well? I suppose.
Oh no, it's yes, it's located in Incheon area,
Mm-hmm.
Pupyeong area. Yeah.
Okay, that's great.
Mm-hmm. Mm-hmm.
I haven't been to Incheon for a few years now, but
Okay.
it was interesting. Yeah.
Okay. Great.
Right, so as everyone is ready, so we will proceed with the presentation and the Q&A session. Thank you so much. Please go ahead.
Okay, so if everybody's ready, I'll go ahead and make my presentation. So hi everybody, we are RisingCraft and I'm Daniel Kim from the marketing team. So we are a startup company developing a rehabilitation program through the brain's visual mechanism. Simply put, we make a program to alleviate pain or paralysis by creating an illusion for the brain. So this illusion enables the affected hand experiencing discomfort or numbness to be perceived and function as if they are normal. So we are focusing on stroke patients, as strokes can lead to all kinds of disabilities. In Seoul, South Korea, there's a steady rise in patient numbers, averaging about 2,000 per month. And over 80% of these individuals suffer from hemiplegia. As our society ages, we anticipate a continual surge in patient numbers. So are you familiar with the term rehabilitation refugees?
I'm not.
You're not. Okay. So today, medical services primarily focus on the acute phase of treatment, overlooking the rising number of stroke patients. The low focus on rehabilitation services leads to roughly 80% of patients stopping their rehabilitation within a year. So in Korean hospitals, patients face economic challenges due to reduced health insurance coverage after 1 month. So unfortunately, the existing rehabilitation programs for a sustained recovery are inadequate, posing difficulties for patients to consistently pursue rehabilitation. So we have developed the sustainable TU rehabilitation solution to ensure that patients do not give up rehabilitation for these reasons. So TU allows rehabilitation across all stages, from the acute phase to the chronic, saving both time and costs. It strongly motivates patients while digitally recording all rehabilitation training data, allowing for feedback from caregivers or doctors. So TU offers a dual model approach. First one is TU Medi for comprehensive stroke rehabilitation from acute to chronic phases, and TU Home, designed for home care during sustained rehabilitation. So to address the rehabilitation blind spot, we developed a product based on XR technology. As mentioned earlier, TU is a rehabilitation program using the visual mechanism of the brain. So mirror therapy is one of the prominent treatment methods for rehabilitating stroke-induced hemiplegic patients. It is a treatment technique created based on the response of both brains just by visually seeing the movement of one hand. To maximize such visual stimulation, we use virtual space and implement rehabilitation therapy effectively by accurately tracking the affected area. So TU provides a personalized training content for patients from the initial stages of rehabilitation to long-term sustained rehabilitation after 1 year. So TU Medi, designed for medical institutions, employs hardware for training during the initial and acute phases, specifically customized for severe patients. TU Home, on the other hand, acts as a gentle transition for home-based care. So our company's rehabilitation content has been created in collaboration with medical experts. It uses data analysis to understand patient recovery stages. It offers customized content. Expert opinions affirm that it's applicable beyond stroke patients to individuals dealing with conditions like phantom limb pain resulting from fractures or amputations. The rehabilitation process for a patient is digitized in real time, offering a service accessible to both patients and caregivers through mobile devices for convenient access. So TU has a competitive edge in terms of pricing and spatial efficiency compared to other competitors. It can save up to 40% of costs compared to existing products, and its exceptional spatial efficiency is evident as rehabilitation becomes feasible with the simple use of VR devices. So in this table, you will find a comprehensive comparison with other products in the market. In Korea, a specific medical device code for software for neuroscience treatment has been established. So through partnerships with major hospitals, we've gathered around 300 clinical data points. These positive outcomes serve as evidence showing the beneficial effects of TU. So our business model includes a B2B strategy targeting medical institutions and university hospitals, as well as a B2C approach focusing on entering the home care market through rental services. So in the upcoming years, we are focused on achieving key milestones. So in 2024, next year, we aim to enter the market by completing development, securing KGMP approval, and obtaining manufacturing licenses, and gradually expanding our presence in domestic as well as overseas market. So our company has established a network with major hospitals in Korea. Moreover, our participation in CES has led to a partnership with the pain medicine department of UCI Health, which showed their interest in our TU rehabilitation program. So beyond our ongoing project, we have the capability to develop programs for individuals with disabilities. So based on this, we will continue to be a company that strives to improve the quality of people's lives. So it was our introduction, and thank you very much.
Thank you. That was a very interesting presentation.
Thank you.
So first, I didn't know you could do rehabilitation using XR. So, and I've worked for NVIDIA before, so I know 3D quite well. But I was not aware of like the medical aspect of it. So, for example,
Okay.
when you mention just observing one hand move triggers like the two sides of the brain.
Right.
That's really interesting. So is that new research that came by recently?
By the way, can you give me a second so that I can share with my team?
Oh, sure. Yes, of course.
So that I can translate and share your question with my team.
Okay.
Okay. 네, 잘 들리시죠?
네네, 잘 들립니다.
네, 그 여쭤본 게 어쨌든 XR이 여기 이제 적용됐는지 이제 잘 몰랐다고 이분도 이제 엔비디아 출신이라 그랬는데 어쨌든
네네.
이게 지금 그 뉴 리서치냐고 지금 여쭤보셨어요.
뉴
네.
리서치라는 게 이제
그
어떤 리서치를 얘기를 하는 건지, 이 작용 기전에 대한 이야기인지, 뉴 리서치라는 게 좀 잘 이해가 안 돼가지고. 네. 일단은, XR이 아니라 저희는 이제 시각적 기전을 시각적 착각을 작용 기전으로 하고요. 그렇게 지금 제작되고 있는 기존에 다른 기기들도 있어서 그 원리를 저희 TU의 XR을 통해서 이제 표현하는 거지. 저희의 어떤 이제 동작을 이제 따라하고 하는 거는 이제 시각적 착각을 어느 정도 유도한다. 이거를 강조해 주시면 좋을 것 같습니다.
Yes, so it's not a completely new research, but but other companies have worked based on this technology that working on the mechanism of a visual illusion. But this is not something completely new. We've adopted this technology, and we are trying to express our technology on the existing XR technology.
Okay, I see. Well, that's the first time that I hear of it, so that's good.
Okay.
And
Okay.
So it looks like so you've explained that after 30 days in Korea, the coverage is reduced drastically. So is that why the product is divided in two phases? Like the first phase in the hospital, probably like for the first month, and then the rest at home?
그 보험이 30일 이후에 그 보험료가 이제 그거 이제 적용이 줄어들기 때문에 그래서 이게 가정용이랑 그거 병원용으로 이렇게 두 단계로 나눠진 이유가 그것 때문에 그런 거냐고 지금 여쭤보거든요.
네, 일단 뇌졸중 환자의 관점에서 보면은
네.
치료 수가가 삭감되는 것도 맞고요. 또
네.
이제 병원 통원 치료에 대한 부담을 줄여주기 위해서 홈케어를 장기적으로 이어나가게 되기 위해서 홈 버전을 따로 개발했다고 보시면 되고, 그 다음에 이제 아무래도 뇌졸중은 이제 시니어 연령이 많다 보니까 그 시니어 세대들한테 VR 기기를 좀 학습시키는 처음 맞닥뜨릴 수 있는 요소로 TU 메디를 처음 만나는 의료 기기로서 만나고 그것을 홈까지 쭉 이어가려고 하는 것이 저희 목표라고 보시면 될 것 같습니다. 그렇게 해서 두 페이지로 나눈 부분이 있습니다.
That's right. The reason we've divided into two phases is because of the reduced insurance coverage after 1 month. So we wanted to aim for the sustained treatment for old people at home. So that's why we came up with two different versions.
Okay, so it looks like even for patients at home, they might need help to run the app and use the XR headset. So do they have access to nurses or people who would help them?
그 집에서 이거를 TU 홈을 쓰더라도 이게 혼자서 쓸 수는 없고 어쨌든 교육을 받아야 되는 건데 이거를 이렇게 어떤 방식으로 교육을 받거나 이거를 앱을 접속하거나 어떤 방법을 통해서 이렇게 교육을 사용 방법을 이렇게 알 수가 있을까요?
첫 번째로는 저희는 일단 TU 메디에서 TU 홈으로 이어진다는 거를 저희는 그 첫 번째 이제 과정으로 시나리오로 잡고 있어요. 그래서 TU 메디를 하면서 그 프로그램 자체는 똑같기 때문에 TU 메디를 하면서 기능이 어느 정도 돌아오신 분들, 재활이 어느 정도 이루어지신 분들이 TU 홈을 쭉 이어나가는 방법이 이제 시나리오 첫 번째고요. 시나리오 두 번째는 이제 TU 홈부터 이제 시작하시는 분이 되겠는데, 그 방문 치료사라든지 그런 재활 치료를 기존에도 이어나가고 계세요. 그 환자들이 기존에도 이제 좀 비싼 비용으로 이어나오고 계신데, 그런 방문 재활 서비스라든지 그런 서비스들의 부가 서비스로서 보조를 할 수 있는 이런 두 번째 시나리오가 있을 수 있고, 이제 세 번째 시나리오는 아무래도 이제 뇌졸중 환자들이 이제 거동이 이제 불편하다고 하시면은 그 보조자나 그 보호자들한테 저희가 교육을 하는 과정이 있습니다. 이렇게 해서 세 가지로 시나리오로 접근이 가능할 거라고 저는 생각합니다.
So for the question, we have three options. First one is the gentle transition from TU Medi to TU Home. So those people who start from TU Medi get used to the whole system and naturally transition to TU Home. So they already know how to use it. But for those who don't know, who start from TU Home, they do not know exactly how it works. So we have trained caregivers who can help them. They visit their houses and they help them with the operation of the application. And the third option we have is that we can train people for specifically for teaching the patients how to use it.
Okay, so the third option is to train the patient and not like someone from the family.
그 환자를 교육하는 건 아니고, 그러니까 세 번째
네,
방법이
보호자나
네.
환자도 교육이 가능하겠지만 아무래도
네.
인지 능력이 좀 떨어져 있는 분들도 있을 수 있고 그 환자의 상태에 따라서 좀 천차만별이기 때문에 예를 들어 뭐 그 절단 환자나 그런 분들은 이제 가능한데 그 환자의 상태에 따라서 좀 그 불가능한 옵션이 있을 수는 있다.
Yeah, depending on the condition of the patients, we can educate the patients directly, but sometimes we can educate the family members, but depending on the situations.
Okay, that's great. Maybe so my last question would be okay, no, so I know the price already because you mentioned it, and then so at CES, will you demonstrate? Can people try the headset?
CES에서 그 사람들이 직접 이거 헤드셋인가요? 이거를 직접 시연해 볼 수 있나요?
네, 그렇게 준비를 해서 갈 예정입니다. 근데 시연 버전이라서 기능에 좀 제한이라든지 그런 건 있고요.
That's right. People can actually try them on, but it's a demonstration version, not a whole package. But people can still try them on and see what it's like.
Okay, that's great. Thanks a lot. That was my last question. Thanks for all the information.
No problem. Thank you.
Thank you so much. So that concludes the session with the RisingCraft. So we'll move on to AVING Labs. Thank you. 감사합니다. 네.
네, thank
you
you.
very much.
감사합니다.
Thank you very much.
See you next time.
See you.